Kia ora koutou. Hopefully we are live on Facebook with the rather fabulous Ineke Meredith. Happy Mother's Day to you, Ineke.
And to you and to all the mothers listening.
Yeah, absolutely, to all of us. Um, and you're here in New Zealand. You're based
Hmm.
in Paris, but you're here for Auckland Writers Festival, so we've been able to nab
Yes.
you for a quick chat. So, your beautiful book, thank you for this on call. I absolutely loved it.
Thank you.
We were emailing back and forth beforehand. I really do like the details of surgery, but also those personal stories of growing up in New Zealand and Samoa. So I suppose maybe can you just first of all give us a bit of background as to who you are?
Well, I'm Ineke Meredith, as you said. I have had the fortune of growing up in both Auckland and in New Zealand, actually, and Samoa. My parents are mixed Samoan Chinese and Samoan English. And I was born in Auckland. And then when I was about 8 years old, my parents moved us back to Samoa. And I lived there till I was about 16 and then came back to New Zealand for university. So I've had this really brilliant mix of having both worlds, but really identifying as being Pacific, even though I've spent most of my life here now in New Zealand. I trained in surgery, as you know, and fully qualified as a surgeon in 2014, but subspecialized in breast cancer and reconstruction and in skin. And then some years later, thought, actually, I think I want to do business. And at the time, I had a dog who had dermatitis, and I didn't really know what kind of business I was going to land in, except that I liked reading about business and learning about business. And as it turned out, I found a little hole in the market that is dog dermatitis. So we started a skincare brand for dogs. And that keeps me busy now. So there you go, a little drop of everything.
Mm, they're kind of different, but still medically
Yeah,
related. Yeah.
very much. And very much I draw on the parallels in human medicine and human surgery, because actually they are absolutely identical, human skin and dog skin, and we know a lot about human skin. So yeah, you're right. It is a little identical.
Yeah, yeah. I would imagine it does quite well. I mean, I know both of our dogs have had skin issues running through the grass in the summer.
Yeah,
So, quite,
exactly.
mm,
Yeah, exactly. It's super common. I think something like 40% of dogs suffer from dermatitis and chronic dermatitis. But because historically dogs live outside and they're running through the grass and you don't wash them.
mm,
Now dogs are more humanized. They live with us. They're on the couch. We're watching them. We're watching their behavior. We're watching them nibble on their paws. So we're kind of just more attuned to what their behavior is.
yeah, sensitive little souls. So,
Yes.
uh, the book is fascinating. And why medicine? What drew you to medicine in the first place?
Well, I think it was more that I did well at school. So, I was in the islands during high school, and I did well. And when you did well in the islands, you became a doctor, you became a lawyer, you became an accountant, sort of those traditional vocations. And I was drawn more to medicine than anything else, actually. And I won a scholarship to do medicine. So it kind of was a series of events that led me to do that. And then surgery really was, as having excluded everything else along the way. I really just loved the how immediate and how the magnitude of the impact you could have very, very quickly, and you could see it rather than, okay, fine, internal medicine where you're giving a medication and you're hoping that something will take effect in a couple of weeks. I really just loved the goriness and the magnitude of surgery.
Is that dog barking really loud? Oh,
No, actually, no. I
okay.
could hear a little something, but no, not terribly loud.
When you're speaking, I might put myself off.
Stevie.
That's Dave, actually, I think.
Okay.
Um, so, how did you because you did colorectal rectal surgery, etc. first, didn't you?
Well, in training, we do a little bit of everything. But for all general surgeons, the most common thing you'll see is colorectal. So hence there's a lot of colo and rectal in particular in the book. But actually I'm super specialized in breast cancer and breast reconstruction. But as a general specialty, most of our practice is indeed colorectal. And of course, so when you're coming through the ranks and training, then most of what you see is colorectal. You're just on mute.
Woof, 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 woof.
Yeah.
So before we go back to that, because I loved the detail in the book, it's your motivation actually that I really want to dig into. So you were pregnant when you were training to be a doctor. Yeah, just talk us through that. How did you find the get up and go?
I think just because, well, actually, first of all, I don't think there was any other alternative, to be honest. You had to get through it, but I had a very strong maternal figure, my mother, who would work at all hours of the morning, all through the night, and she would just do it. She would just drag herself out of bed, and she would work because she had to work, and so that was the role model for work that I had. So I could always work. And because she was up at 2 in the morning, I would get up at 2 in the morning to help her because I couldn't let her work alone. So I think I always had that vision of work and what work was like, and that actually it was painful. and and then I think I just somewhere along the way, I just had this thing inside me, which is you can, and we're women and we can and we must, which is a wonderful thing, but at the same time, it can be a little tiring because then it's never ending. But I think, there is no alternative for me but to be able to finish it and to get to the end. Sometimes I love to run. And so, for example, I ran a big run a few years ago that was 30 kilometers. And you have this vision of what it's like at the end, and it's so, so tiring, but you just say one foot in front of the other, and that's what it's like.
Yeah. I suppose doing that whilst you're pregnant, that is like every day is different when you're
pregnant. Yeah.
Yeah.
But I had family, and I always say I would not have been able to get through it without family. It would have been different if I'd been completely alone, of course, but I had the luxury of having my mother, who was, just totally embracing, and my sisters and my brother. And without them, I don't think I could have been able to do it. So in large part, it was having that kind of network.
So there is that sort of you're so honest in the book. You talk about your guilt a lot, about leaving your baby, and he goes off to live with your sister at some point.
Yeah, my mother and my sister.
Yeah. So how was that? How do you balance that?
I think I just did what I had to, and there was really no. Of course, you can't plan for it because you just can't plan, and I feel like you just did whatever. Well, I just did whatever I had to keep my head above water. And my mother just adored having a grandson, and she wanted to spend as much time as she could with him. And I was trying to juggle training and surgery, and I knew that I had to get to the end to, to have a life, to be able to provide, and I just didn't see any other way but finishing that. And so I relied a lot on my family, on my mother. So there was really no kind of forethought about how I balance it. It's just how I get to the end and how I survive. But it's been quite interesting now with the book over the last few weeks. I've just had so many messages from women, and it's been very interesting because I didn't realize how much the book would impact people from different walks of life. You know, I've had messages from colleagues, from actually spouses of colleagues saying, I never realized what it was like for my spouse. And actually from women who say, you know, I thank you for writing it about it so honestly. You know, they're also in high demanding professions, and it doesn't even have to be a demanding profession for women, because women bear the brunt of the family and bearing the children and raising children. And then when you're trying to juggle a career, in addition to that, you're always going to have those sacrifices and those compromises and those pulls, which of course are always difficult.
It is the mental load as well as everything else, isn't it?
Absolutely, yeah. Yeah, I think we suffer a lot from the mental load, actually.
Yeah. And some of that's societal as well as what we put on ourselves.
Yeah, absolutely. Absolutely. So this is the problem with thinking that you can. Because of course it's easy to think that you can, and of course I always thought that you can, and why not? But then you realize that you can, but it will come with compromise and sacrifice, and you can't do everything 100%.
Yeah. Compromise and exhaustion. I think that,
Yes,
you know,
yes,
especially reading your book, it made me
yeah,
tired just looking at what you were doing. And I think I like that you had messages from the spouses as well of the people
yeah.
that you live with, because most of us don't know, and we don't know what it's like to work so relentlessly. But that does take me on the nitty gritty detail to that question. Can you describe what that's like to open somebody up, and to what is it like operating on somebody?
Um, well, I think if I take a step back and think about it, it's of course it's strange, you know. When we're living in the moment, it's just it comes to you normally. You know, we have cases booked on the board, and one's for an abdomen, one's for an amputation of a leg, and you know, so you're just living in this world which is body after body after body after body in different theaters, you know, opening different parts of different bodies. So when you're in amongst it, of course, you just it, it's adrenaline charged. It's you know, you're fighting, there's tension, but and it's tense, you know, the theaters can be tense because you're fighting for space and resource all the time. But if I take a step back from it and look at it, then of course it's bizarre, because people are very, very ill. Of course, most of the time people are ill when they're requiring surgery. Um, you know, you've got people learning, you've got people teaching, you've got students who are feeling bowel for the first time. You've got smells, you've got, you know, of course, when you're doing colorectal, you've got the smell of feces in the room. And, you know, when you've got an emergency bowel case in the theatre block, you can smell the feces all the way down from the start of the theatre block, you know. So there are the smells, there are the sounds, which of course nobody will understand unless you're in it. But you know, we have this, you know, this before every case we do this timeout where, okay, everybody who's going to be in the theatre room, um, you take a moment, you make sure you've got the right patient, you make sure we've got the equipment, we make sure that you're doing the right side, we introduce everybody so everybody knows each other. um, you know, you just take a moment to go, okay, this is the team, this is what we're doing, concentration, this is what we're expecting. Are we expecting any disaster? Kind of like the pilot checklist, you know, before takeoff. Um, so I think that's a really important moment always for me, where you go, okay, fine, in amongst all the adrenaline and the tension and the fighting outside, and the next person wanting to get into theatre, and for you to finish this case quickly so they can come in, we are all pulling ourselves in and saying, okay, that we have to concentrate right now on this person, and make sure it goes as safe as it possibly can, you know?
Yeah, I never realised. I suppose I knew there were checks and balances, thank goodness,
Mm.
but that's quite detailed. So how can you do, are there strategies that you're taught for when you're in very long surgeries, and maybe you're teaching someone to do it as you go along? How do you remain patient and calm,
In the
especially when something?
long, yeah, in the long surgeries, well, I think you just learn well, we kind of fall into what we enjoy. So, in med school and training, you go through attachments. And of course, some surgeries are shorter and some surgeries are longer. They can be 10, 12 hours or they can be 30 minutes. And kind of you weed yourself out, right? So people who don't enjoy the long operations will stick to the specialties with shorter operations. And if you enjoy the long operations, then probably you're going to be, just to look more, engage more in the subspecialization for longer surgeries. But in truth, you don't really pay attention to time. Of course, so once you get to 4 or 5 hours and your neck is aching, yes, but you kind of just get to the end, and you can't really pay attention to time because you you have a goal at the end.
Mm,
So of course, some of the bigger operations like the pancreas or the esophagus, sometimes they can be 10, 12 hours long. But okay, you might say, right, well, I need a tea break. I'm gonna take a tea break. Just, leave everything as it is now. I need a drink of water and come back. But otherwise, you don't really have this impression of time because you just have to get to the end. Somebody said to me years ago, I have to go to the toilet, I have to pee all the time. Is that going to be a problem for me? I love I can't remember what she enjoyed, but it was something that was long. And she said, but I need to pee all the time. Is that going to be a problem? And I was like, well, actually, it's not really a rate limiting factor because you just, sometimes you worry about having an itchy nose or having an itchy back because you can't touch yourself. Of course, you're sterile, but actually, everything just disappears.
yeah.
And you're kind of just in that moment where you need to complete something and you can't think, okay, I wish I didn't start this. Actually, you've got to get to the end.
That's fascinating that you can have a tea break. So you would just hit pause? There's not two surgeons there.
Well, no. Well, sometimes there are two surgeons, or sometimes it's at a position change. Like if you're, for example, for some of the breast reconstruction work, if you're changing position, then you might take your gown off, have a cup of tea while there's a position change. Not really a cup of tea, a cup of water, really. And then, but at least just a break, and
Yeah.
then come back into the room. For the 3, 4 hour operations, it doesn't really matter. But of course, when you're hitting 12 hours, you have to have a break.
Yeah.
Yeah.
It almost sounds like that should not be allowed for someone. Bus drivers can't go for that long. And this is
Yeah.
just as important as, yeah, anyway. um, is it, this is an odd question, I suppose, but it's really complex. I'm going back to the colorectal, this bit. Um, it's such a complicated part of the body. There's so much stuff in there. Do you find any beauty in it? Is there
In the
aesthetic?
bowel work, yes.
Yeah.
Yeah.
Can you
Yeah.
please explain?
Because it's very fragile work. Actually, one of the surgeons that I worked with, he had the most wonderful hands, and he was a colorectal surgeon. And because there's a bowel, you open the abdomen and there's a bowel everywhere. Even the art of packing it away so it stays out of your way is very strategic. And it's very fragile. It moves, it glides most of the time. So there's a beauty in the movement of it. And even in the reconstitution of bowel, you're rejoining bits and pieces, and you're imagining the way it should flow, and to get a patient off the table to re-establish um, flow, for want of a better word, or patency. And there's a lot of beauty in that movement, in the movement of restitching the bowel together, because it is fragile, it's soft, you've got to be very careful with it.
Mm. How, when you say like, I have so many questions. Repack. Where does it go? So you like, just more space in the body, like when you're pregnant and everything moves. When you're
Sorry?
pushing it out, when you're pushing it out the way to concentrate on one particular part, where does it go?
Oh,
When
you might pack it into under the liver, or you might pack it into a corner, really.
Yeah,
Yeah, we've got a bit of space in there to pack things into. So plus you've
yeah.
got the abdominal wall is pretty pliable.
So I can see how the job would just take over most waking thoughts. If you're doing surgeries that long, how do you switch off from that? So
Yeah.
just how did the job take you over?
Well, as you say, it's just hard to switch off, even, but to be honest, even my friends who are emergency medicine, she finishes at the end of her day. She might finish at midnight, and then she won't sleep until 2 or 3 because you are thinking about everything that happened in the day, what you might have been able to do better, what you might not have had time to do. And you're really winding down from that adrenaline where it's go 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 all the time, and emergency medicine is go 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 all the time because you're trying to get patients out of the way. So that's okay, that's on a daily basis, but from even on holiday, and my husband's a surgeon, and and his patients are in Paris, and you're constantly on the phone. Of course there are problems, or patients who are anxious. So you constantly have this background noise, especially, and if you operate enough, then you're always going to have it. That's just normal. And of course, you're always going to have patients who are anxious and who need attention. That's normal. Um, and then you've got the just the from the acute work, the mental load of when you're on call, you're often fighting in theatre for theatre space. You're, arguing with other specialties, trying to get theatre space. So there's this constant adrenaline and fighting for your patient. And then you're in theatre operating, fighting for your patient. So there's this constant thing where adrenaline all the time. So yeah, it takes over, and the nights are short. You're just going from one day to the next, and when you're on call until until the next morning, you don't have a lot of downtime to get over that. And probably in truth, we're not well trained to get over that, to debrief, to take time out, because there's this thing still in surgery, which is the rite of passage, right? You are an apprentice, always you're learning, you're operating. The more you operate, the better you are. You have to get through that to become a surgeon. And there's no real space for debrief, or for you know, saying, well, actually, fuck, that was a terrible shift. I'm not feeling very like I can come in tomorrow, actually. Well, tomorrow you still have a full list,
Yeah,
and you still got a full clinic.
yeah,
So you just have to do it.
yeah. I mean, a lot of that would be life and death too. So
Yeah,
you can't not turn up, can you?
yeah, exactly.
Yeah. What was it like? Like the very we haven't got long actually. So many
Okay.
questions. What was it like the very first time that you were? It was you. It was your. You weren't apprentice anymore. There was no one looking over your shoulder. It was just you.
Well, there are different moments to that because, of course, you kind of at each level of training, you become independent in one operation. But for us, most of the time, an appendix, for example, is one of the more common operations we master in our younger years. So you assist with with a keyhole appendicectomy for several cases, and then when you feel confident enough, you might try it on your own with somebody in the room, and then somebody in the tea room, and then find he's not even in theatre block. So you kind of do that, and then the next operation might be your gallbladder, and again you assist multiple times when you feel you're doing bits and bobs of the operation, and then you feel confident enough that you can do the whole thing on your own with the guy maybe holding the camera, and then in the sitting on the computer, and then in the theater tea room. So we have those kind of graduated levels of independence depending on the operation itself. But the most, when you do your appendix, it's a big deal. I mean, it's one of the more standard operations, and all our junior staff can do it. But when you do that on your own, of course, there's anxiety. But to be honest, even now, when being a fully qualified consultant, every time you operate on somebody, there's anxiety. You got to think, you never lose that. And I don't think you should, because once you lose it, then you become complacent. But of course, you're anxious, you're worrying about what can go wrong, what you might do wrong. But you just have to trust that actually you're good enough, you've trained enough, that somebody would not have let you do that if you were not skilled enough, and that there's backup for you in the next room.
So you're still practicing over in France as well as?
Yes, less and less. Yeah.
So it's the fur.
It's the fur love.
Fur love. I always said fur babies.
Yes.
The fur love that's
taking my time.
Yeah, which is fair enough after all those years of surgery. Do you miss it?
I miss it. I miss the camaraderie. Actually, there's a lot of camaraderie in surgery with the junior staff, with your colleagues, and of course, especially on those on-call days, we operate as teams, and that's really quite a rewarding part of the job. Plus, you're helping people. You have a major impact on people's lives, and so of course it's hard not to miss.
Yeah, for sure. There's so much more to talk about, but you are at Auckland Writers Festival. People can get it, and also you need to read the book, people, because it is just so amazing. We didn't talk nearly enough about your time in Samoa. There's your family relationships in there.
Yeah.
Your lovely little boy who's not so little anymore.
No, they grow up.
Yeah, don't they? So thank you so much for spending this time with us.
Thank you.
Amazing. And
thank you.
Will there be another book coming at some point?
I'm not sure. I'm not saying no, but I am thinking what it could be.
Yeah. Well, we'll look forward to it.
Thank you.
Thanks so much, Ineke. And
thanks for having me.
Yeah, we'll see you again. Cheers.